pledge allegiance to the flag
of the United States of America, and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Thank you very much for all coming. Need the approval of the minutes or any changes thereof. So moved.
Second.
All in favor?
Aye.
Opposed? Motion carried. Number 5, introduction to visitors.
Hi, I'd like to introduce Caitlin Parker. She's the Director of Environmental Health to provide an overview of mobile home parks. That's part 17 of the New York State Sanitary Code and temporary residents, motels, hotels, and cabin colonies. And that's subpart 7-1, both fall under the statutory authority of Public Health Law 225. Caitlin?
Thank you. Again, hi everyone, Caitlin Parkhurst. So before I get into some of the specifics of mobile home parks and temporary residences, I just wanted to do a brief, general overview just to make things make a little bit more sense. So as Vera stated, both of these programs do fall under public health law under the New York State Sanitary Codes. So under public health law, we kind of have how we group them in 2 different sections. The sanitary code section is programs that we issue set permits for and have set inspection standards for, where some of the other programs don't have that. So both mobile home parks and temporary residences are 2 of these sanitary code programs. We have 12 total. So lots of them that fall under that structure, but then we do have some other programs that are a little bit different. So just wanted to kind of clarify that just a bit beforehand. Also, just for some visual aid, and I can send this to Vera or send stuff out afterwards, we have actual little code books that go over all of the regulations that these programs must follow. These are available online, but we mail these out to operators as well, just for a little bit easier reading. Additionally, and again, these are kind of outdated. We don't use these anymore, but it's a good visualization. So these are inspection reports. We used to use the paper ones. Everything is electronic now, but these actually list all the violations that we can write for that program. So this is a mobile home park one. I've got a temporary residence one, and then water is kind of a separate thing, even though it's at some of these facilities. So just as a visualization, this is kind of a reference point of what we actually have the authority to write violations for at some of these facilities. Again, we use them electronically now, but I could always scan copies of these if anyone is ever interested in seeing the violations for these programs or any other programs as well. So kind of onto the other stuff again. So our main responsibilities for both of these programs are to issue the permits. They have to fill out set applications, they have to send in insurance information, and pay the permit fee. Once we get all the permit paperwork together, everything's approved, we actually print a permit and send that to them. After that is done, we do routine inspections. These are set in a frequency by the state. Generally, we try to do everything once a year at the bare minimum. Some of these are every 2 years, every 3 years. We try to keep everything the same across the board and try to hit everything once a year. We feel more is better than less. But that all comes from New York State Department of Health. In addition, we review plans for new facilities. If anyone is adding on, expanding, doing any major improvements, we have to approve all of those plans before they're allowed to do them, including engineering plans. We have an engineering division that will do those, just to make sure that everything is in compliance with sanitary codes. We investigate complaints for both of these programs. We receive the complaint, we confirm it falls under our jurisdiction, and then we write it up and conduct inspections and follow-up as necessary. We identify violations, we issue deficiencies, we might take enforcement action. It kind of depends on what we find. So that's just kind of an overview for both programs, and then I'll kind of go into some of the specifics for both of them. So for mobile home parks, the definition of a mobile home park is anything with 5 or more units. So as soon as you get to that magic 5 number, it falls under our jurisdiction and we have to permit them. So we do get calls every once in a while about parks that people say that have 3 or 4. Unfortunately, we don't have jurisdiction over those, but we do try to help and refer them to whatever agency can help them with whatever issues they come across. But 5 is the magic number for our office. So some of the main things we look for when we're inspecting mobile home parks, one of the biggest ones is water supply. This is kind of the biggest, I say problem, but one of the biggest things we have to look for that can cause a lot of problems at a mobile home park, especially for those that have 15 or more units. There's a lot more extensive testing they have to do because they're supplying so many people on a regular basis. So there's a lot of stuff that the parks have to do in order to maintain compliance with the water program. Making sure the disinfection is there, making sure the pressure for all the units is there. Obviously, some of these big parks have a lot of plumbing. There's a lot of potentials for leaks and different things like that. So we kind of do an overview of all of that when we go for these inspections. One thing to note, just kind of overall, we do not go into the mobile homes. We don't have jurisdiction on the interior of them. The only time we would enter someone's home is if we had to take a water sample out of an individual trailer, or if we had to confirm that they didn't have water. Generally, we don't confirm it. We take, if someone calls us and says we don't have water, we call the park manager right away and tell them they need to fix that. We don't need confirmation. That would just be a case by case basis. Usually we take their word for it and we tell the park manager they need to fix it. So sewage disposal is another big one at mobile home parks. We obviously check to make sure that the septic systems are working properly. Look for any evidence of outbreaks. Usually what I have inspectors do before they go out is they check to see where everything is, the septic system, the leach field, things of that nature, just so they kind of have an idea of where to look to see if there's a problem. It's not always super obvious. You think maybe you smell it, but there's other signs to look for. So I make sure that they're aware of where the stuff is before they go out. And then obviously if there is, we take care of that with the park manager as needed. So some of the other things that we look for, like roadways, we want to make sure that emergency personnel can get in there if need be, no major potholes or blockages in the roadways, and for just everyday use for the residents, of course. Separation distances, this isn't really something we run into because we would approve this before a new unit would go in, but if someone were to add something to their home, a deck, porch, something of that nature, they need to meet separation distances, so we check for that as well. It's a fire safety thing. They have to have a responsible person in charge to take care of any issues, so we make sure that they're readily available at all times. And then just kind of like some general site maintenance and sanitary conditions. So garbage, anywhere where insects or vermin could harbor, we look for things like that, right violations accordingly. So mobile home parks have a strong collaboration with us in code enforcement. There's a lot of stuff that falls under the code enforcement department, a lot of building structure and things of that nature. So if we have a trailer that is dilapidated, roof is falling in, things like that, we can write violations for the harborage, but when it comes to the actual building code, that is something enforced by the code enforcement department. So we will refer that to them. So we really have to have a very good working relationship with the code enforcement departments in all the towns when there's issues, because a lot of times it involves both agencies. Because obviously we can't write something that doesn't fall within our jurisdiction, but we will help wherever we can. So I just kind of wanted to touch on some of the stuff that the code enforcement looks for. So they obviously look for the building code, everything that goes in that. I'm not going to pretend like I know the ins and outs of the building code because that's not something we enforce. Zoning regulations, unsafe structures, occupancy requirements, structural safety, things like that. So again, roof damage, collapsing porches, abandoned or unsafe structures, things of that nature would really fall under them. Same with like condemning a unit, that would fall under the code enforcement department as well. That's something we get asked a lot, and we definitely aid in writing any violations that we can help to assist in that process, but we can't actually enforce condemning a unit. So sorry, just threw a lot out there for mobile home parks. But temporary residences, I'll touch on that a little bit as well. So that definition is any hotel, motel, or cabin colony that sleeps 11 or more people. So it's all based on the number of people it sleeps, not like the size or the number of rooms. So we do have some that are exempt from the code, and if we ever come across those, we actually have a certificate of exemption that we make them sign and notarize, and we go out and do an inspection just to confirm that it in fact doesn't sleep 11 or more people. So if they ever do change and add more people without our approval, we have that on record to show that they knew that they could only sleep 10 or less people without a permit. Yeah.
Yeah,
Sorry.
Crap, you're right about that.
And I can definitely follow up if there's any specifics.
You know, let's stop right here just a
Yeah,
moment.
absolutely.
Where does Airbnbs fall into this?
So Airbnbs, if they do sleep more than 11 people, they could potentially be a temporary
I
residence.
don't care how many they sleep, how many people that go there. That's where the issue is.
It's sleep.
Yeah, it's sleep. So it's number of beds. So if they have 2 king size beds, we count that as 4 people. If they have a pull out couch that sleeps 2, we'll count that as 6. So we always try to, anything more than a twin size bed, we count as 2 people, even though I know maybe that's a little unrealistic, but we try to go on the higher side of things. You know, how many people it can sleep.
each town has their own codes, like the city, that would never fly in the city, that's not happening in the city of Oswego.
No, and towns and cities always trump what we do.
Okay,
They
thank
can always go above what we do. We stick with sanitary.
so ours is less. We can't, in the city of Oswego, you can't have a house.
That's what I'm
of
saying, it's-
14, 11, 14
No,
people
right.
in it.
Yeah.
We don't have any.
But that's
It's not good
state
cap.
sanitary code, but
Okay,
the towns and villages have their own code that you need to go.
and you follow their codes, obviously, each
Yeah,
town,
yeah.
Absolutely.
village, okay, thank
Yep.
you.
This is just generalized sanitary New York
Yeah.
State code.
Oh, okay.
Yeah. There have definitely been a lot of conversations at the state level too about Airbnbs because a lot of counties are seeing issues where people are claiming they don't fall under a code when they should. So they've actually been working on redoing the language of the temporary residence code as well. It just haven't got.
And with
anything
pools,
done.
it gets pretty complicated.
Yes, there's actually something very similar with pools with a swim renting type thing, but thankfully we haven't run into that yet.
Oh, if you're ready, I got a lot of questions for
Okay.
Bill.
All right.
And I do too when you're ready.
Okay.
Okay, let's have, be recognized by the chair, please.
Legislator Novak, you have your hand up? Did your hand up? No. Let's go with,
I'm probably a little bit more unique than the rest of these legislators because I happen to have 6 mobile home parks in my district.
Okay.
And it's a nightmare. And I'm telling you, it's a nightmare because you're stuck with, for example, the structure. We talk about the structure. Some of these homes are older than old. I mean, this the little old grandma that's been there since 1959 when she bought the 10 by 50, and that's what's there. And the home's not safe. But then again, here's the flip side of that. Where the hell will we put her? I'm not going to make her homeless. And it's whose responsibility? It's not the mobile home park if it's her home.
Code. It's inside, it's structural and it's code, it falls on code.
Okay. That's where it goes. All right. So a lot of, now, when you talk about, the cities would have the same type of issue, I'm sure, the fire safety of these. I go to all my mobile homes because those people do both. And I'll tell you something, it is, the older the person, the narrower the path. You never, in a lot of these cases, you can't get a structure there, not gonna happen. And where does that fall?
So getting the units in there, so like the roadways, that
Well,
was
it's-
like that you can
You
get
got
it.
clutter,
Yeah.
you got a place for, and believe me, I've seen rats bigger than you one, seems like. Anyway, some of these places, and it's unbelievable.
Yeah, so if it's clutter on the outside, like junk, that would be code enforcement. If it's garbage, household garbage and that kind of stuff, that would be the health department. So generally, it's both of our jurisdictions because it's usually a combination of both. But if people have like old lawnmowers and scrap metal and things of that nature, that would be the code enforcement department that would have to be responsible for cleaning that up.
All right, you mentioned about the water systems and the, sewer.
Yep.
Or wastewater. None of my mobile home parks have either one. None. They're out in the middle of, I'm not gonna say la la land, because they're not, but the thing is.
So they
I got
have
one-
wells and stuff.
I got one town, you can't get water district approved in there if you wanted to pull your teeth out and do it. Where do we fall on that? Because I know one of them's got a consent order, we're not gonna go into the name of it, but you know what I'm talking about, I know you do. And he's trying to sell it, so he's trying to get away from that. But the point is, where's our responsibility fall? Because you can't shut them down, because this one mobile home park is Well, it's not the largest, but it's close to it. What do I do with all those people?
But people can have wells
Yeah.
and septics.
Oh, they all have wells.
Yeah.
Right.
I
And
mean, they all
septics.
have wells and, all but one has a central septic. How well they work, that's a good question.
Right.
And that's what Hafner's job, or it should be. Check that out and do whatever he has to do, but, you know, I look at it as mobile home parks can be, and I do, I have one that's over 55.
Mhm.
Thing is fabulous. It's got older mobile homes, but they're clean as heck, or they remodel them. Why they remodel them, I don't know, because it costs more to remodel than buy a new one. You know, the thing is, this is a complex subject for somebody like myself. I'll tell you, it's really complex. Because they need help.
Yeah.
And we talk about the big, word in the sky is affordable housing. You're not gonna get a cheaper place to live than a mobile home park. And I know we have a study going on down on the 3rd floor, they're working on that. Tim has it, I think I talked with him last Friday, because where are we on this? And we can make this a place to help people be able to find a place to live.
I agree.
But we need your help, I need your help to get these things cleaned up. And I know the one that we talked about, the consent order, that somebody new's taken over and they haven't get some of these mobile homes out. The trouble is, they probably got 50 of them that got to come out of there. And they're not cheap to move when they're old. Or tear them apart.
Yeah, it's a very time consuming process getting things cleaned up. And the water, I mean, it's time consuming and it's expensive. I mean, every year the state seems to come out with more and more stuff that can be found in water systems that need to be sampled. Mobile home parks have a lot of sampling requirements when it comes to their water because of the number of people they serve. Obviously that then takes into account how much more money they're spending to do sampling. So then when there's fixes that need to be made, we have more issues. The state has definitely been trying to find ways to cover that sampling so that the mobile home parks focus more on fixing the issues rather than just making money in the sampling. But yeah, it's a complicated process. Water complicates things a lot because there's so much that goes into it. I 100% agree. And what the solution is, public water, of course, but that's, like you said, that's not gonna happen in some of the jurisdictions, unfortunately. We just really have to be after the owners to make sure that they're maintaining stuff, and if it means bringing people to enforcement, we will. Like you said, we can't close a park, we could, but what solution,
What do we do?
Exactly.
We're just pushing
Exactly. It's really,
to another agency.
right, it's really trying to find avenues that help, especially with the cost of some of these fixes. I know PFAS is a huge thing coming out right now, and it's very, very expensive, if not almost impossible to treat in some water systems. So that's something that people really need to look for different grants and different solutions to try to help to treat the water, because it's very, very difficult to help.
All right, who's responsible, it doesn't have that name, but the responsibility of the road, I know it's gonna be the owner. Some of these roads are tough, Jake.
Yeah, we would write those as violations if they're in rough shape where people can't get in and out safely. That would be under us, to write those violations.
And if there is a complaint, let us know because we will go out and investigate that complaint.
So most of these, most of these trailer parks, some of them have independent wells on all lots.
Well, the one you used to deliver oil to definitely has.
Well,
The one at two of them in San Richard, both independent wells. The
never-
two out in Pebbleville are independent wells.
I think Linden Lawns and Central Square have.
But yeah, but that's, you got water over there. I don't.
Yeah, but we didn't have it one time.
Well, I
We
understand.
do now. We didn't have it one time, and I think they had 4 wells, I believe, that supplied the park. I'm sorry, go ahead,
No,
Mr.
you're fine.
Legislator.
I got, thank you, by the way, for coming in, and I appreciate your having you on the agenda. And you seem to know what you're talking about pretty good. And we talk about, Chairman just mentioned about septics and a little bit of water, I'm sorry. Doesn't the whole Oswego County have municipality water?
No.
The whole county is not.
You got out of a Sligo bar.
I work, live, I very rarely, you know,
I'm telling you.
well, I'm not up that way much, but
It-
up
And I'm in a more populated area actually than you are because I'm right 2 miles from Route 31. That's the next county over.
I just thought Oswego County.
No, Claremont doesn't, Alpar,
Yeah.
there's a lot of pockets throughout the county that do not
Yeah.
have some areas of Hastings.
Learned something today,
Yeah.
thank you.
Town of Hastings is the only town in the county that has 100% water.
Right.
It took us 15 years to get.
Yeah,
So without Onondaga County, when they came into the water district, I thought the whole county,
Yeah,
you know.
No,
You
there's,
see, because I know Hannibal has, Oswego Town has,
yeah,
you know,
And there's other,
Granby.
I don't, so, yeah.
there's other towns in the county, like Richland, that has their own wells to supply farms, so Sandy Creek and.
Okay,
There are some too where the public water runs nearby for some parks,
Tie
but
in.
then, yeah,
You gotta pay
mine
the tie in, I
is,
understand
especially
that.
for some of the big parks, so. I don't know the exact number, I could probably get you.
Sure.
I would guess, I mean, maybe I'm a little off, 50-50 mobile home parks on
did not
public.
know that.
private.
I know.
I could be off, but we have quite a few that
Okay.
are on.
How much is the permit fee?
So mobile home parks, it goes based on how many sites, and I do not have that on me.
Okay.
I can send a copy of that.
All right, that's okay. How many parks in the county?
we should have that result by the end of the
Okay,
month. That's what Tim told me we had
Yeah.
it done.
Yeah, I know I have gathered quite a bit. There might even be the number on private water, because I know they've asked me for some data on some of the
I
stuff.
will email you, we will get that
Yeah,
number and I will
definitely.
email that number to
and
you.
who paid? Now, here's some of the things. I actually got a call and I believe it's, I'll share it. I got a call for somebody complaining that they were in a trailer park in, Granby, and they were very dissatisfied. And it was about trash removal, who pays for trash removal. And, you know, I was getting calls that there was rats as big as cats out there and all sorts of stuff in the parking lot that we talk about. You know, I actually went out there one time, years past, and there was potholes, you know. You couldn't drive a small car through there, that's for sure. If you didn't have a pickup truck, you were in trouble. And, so, you know, I know some of these parks are in good shape. We have one in Oswego Town, it's called, Thompson Trailer Park, and, Thompson Manor, I think that's the right word for it, and they've done a good job, but this is a learning curve for me, and I appreciate all the information because, it's good to know, like, we talk about water and sewer, and I know, I would imagine, some of the parks that are out on, in Granby, and I call it the old Shilson's Ponds area.
Yeah, it's a country haven, it's on Rathburn Road, it's
Yes.
just Granby and Hannibal.
Okay,
That Mark owner lives in New York City.
yeah, so we have an out-of-towner that's not even close by, Syracuse area, it's New York City, and you drive out there and it's like,
He's not low.
some of that out there is like, being kind is like a war zone. And I know it needs attention out there, that's for sure, but, I'll leave that to, I don't know whose district it is. Oh, it's Hannibal, okay, so, but, thanks again for coming in, and if I could get those
Yeah,
answered
definitely.
sometime,
Absolutely.
not
Yeah,
right away.
I can
but
get that.
I appreciate
You'll
it.
have it today.
Yeah,
Okay, I thank you very much, thanks for coming.
absolutely.
Anybody else?
I just want to say thank you for doing all that too. I know that we spoke about the Hannibal
It's been
Park
a,
for a couple
it was
of
a
times.
very busy mobile home park year.
Yes.
Yes,
Yes, I am. Yeah, and if there's any other specific questions that come up after the fact, definitely let me know, especially numbers and stuff like that. We can pull those pretty quickly.
Great conversation.
Yes.
Information some of us didn't know. Thank you very much, Kayla. We'll move on to resolutions. Resolution fixing the time and place for public hearing related to the proposed county of Oswego local law number 7 of the year 2026 entitled local law regarding the sale of credit within the county of Oswego.
So moved.
Second. I have a,
All in favor?
Oh, do you want to just,
Oh, no, I gotta have discussion. I gotta have open discussion. I want you first.
HE1 is a resolution requesting a public hearing on proposed law regarding the sale of kratom in Oswego County. Oswego County Health Department has taken a proactive public health approach to implementing the New York State Public Health Law 1399-MMM regarding the sale of kratom to individuals under the age of 21 years old. Kratom, or Mitragynma speciosus, is an unregulated substance that may pose a public health risk, particularly to adolescents and young adults. Rather than waiting for the problem to occur, our goal is to educate retailers increase awareness on new requirements, and prevent the underage access before it becomes a larger public health issue. The proposed local law establishes a clear definition and provides the county with the authority to do enforcement of the prohibition on sales, distribution, or transfer of kratom to anyone under the age of 21. This initiative is focused on protecting our youth, supporting retailer compliance, and promoting the health and safety of our community through prevention and education. Our emphasis will be on outreach and compliance, with enforcement serving as a tool to ensure adherence to the law when it's necessary. I did bring a little cheat sheet of what you should know about kratom, if you want to pass that around. Just a quick answer question, what kratom is. To answer any questions. It might be the first time people are hearing about the word of kratom. Kratom is a tropical tree native to Southeast Asia. Its leaves contain natural occurring compounds that act on the brain and the nervous system. Depending on the amount that is consumed, kratom can either produce a stimulant-like or an opioid-like effect, and it can be sold in many different ways. It does fall under, it's what our super grant is under, and this falls under that. There's a lot of public health risks, there's dependency. I do know of one case in New York State that was an overdose that happened in another county. There might be more instances since I've looked it up. It's a pretty scary substance.
Legislative party.
Yeah, actually, I spoke to a mother from United County just this morning. Her name is Wendy Chamberlain. And she lost her son in United County, and they passed a law to ban it. So, I definitely know that we're going to see effects of this. Of course, he was a little bit older than adolescence, but we definitely can do, pull through to try to curb it so we don't have any kids getting their hands on it, especially when it comes down to having easy access to, just pull it off the shelf and maybe walk out the door with it, And I think I spoke to another mother this morning too, Susan Hubbard. She's actually from Michigan, but she made a perfect example, and one of hers was that, Sudafed is behind the counter. You have to use ID, why are we doing this for this? And it says all natural substances, fortunately. I know that we didn't pass the law just recently, so it's saying that we're supposed to have,
Lock cabinet beyond the counter,
yeah,
lock them behind the counter. It's New York State law.
but, and 21 hours.
And 20, yes.
So was her son under 20?
No, I believe she said her son was a little bit older, like, I can't remember. I know Michigan 22, and I believe Wendy's, I can't recall necessarily, but he wasn't an adolescent or a teen. And he had no drug issues, was using it as a natural substance, because that's what it said. And, don't realize what kind of repercussions these substances have because they didn't have any warning labels on them, just go by natural substance, and then all of a sudden,
In the Asian culture, it's very common for everybody to wake up and drink kratom like it's a cup of tea.
Really?
Yes, but in large amounts, because it can give you like a stimulant effect, like you drinking a cup of coffee.
Right.
But in very large amounts, it's like opioid.
And especially their client.
We'll just change it from 21, just outlaw it.
that's what
That's what I would suggest. And you guys,
I would.
that's your own opinion, but I'm dead set against all drugs, so this is just another one.
Legislator Walker.
Can we change it right here at the table?
We were asked to draft a law on 21 and under. We can certainly take a look on an outright ban. Is before the committee, I would note that this law passes through many of the articles need to be numbered sequentially. There's a gap, probably because of all the edits that occurred. What state law requires is that the legislature designate an enforcement officer for purposes of public health laws, so that has to be done by local law. Oneida has a public health order, which is likely done under their sanitary code. We operate under state sanitary code. We don't, not a charter county. So we can take a look at that, and my suggestion to the director was bring it before the Board of Health this Friday for suggestions. And also, if you set a hearing, you'll get the input on where people are on this issue and whether something more comprehensive needs to be passed.
That's very fine.
Yeah, well, Richard, if we approve it for this, just under 21, why don't we just pull this and wait till we have a correct, that would be,
We certainly,
in my opinion, I think that's the way we should go.
we were asked to prepare the 21.
I don't care how you do it.
Well, we can certainly do that. That would not be voted out of committee today, obviously. but-
Obviously, yes.
So we could do that, if you wanted to vote this out of committee, we could certainly amend the law as well. But we do either, if you want amended local law, do an outright prohibition. There still are requirements that the county legislature designate an enforcement officer and procedures under public health laws. So
Would
that
be our Board of Health.
Board of Health over the department. So we can certainly change that and get it back to the committee, and that's the committee's wish.
I prefer we still,
Let's say you're walking.
Thank you, sir. Richard, we're here now. I want to go forward. Can we make the motion and pass it, or unless you tell me no? Why can't we? You kind of mentioned it, but I want to make it now, so we ban it. Just like the legislator pointed out earlier, and I'd be willing to make a motion to the floor to do that and vote here.
We could draft something and have it for the committee, consistent with that. I'd like to look, the state was supposed to promulgate regulations. I know Oneida did this by health order. State was supposed to promulgate regulations. I have not seen those yet. We can draft a local law banning it and get it for the committee. That's fine. I just won't have it today, obviously. I need to go back.
This is just approving a local law, it's not a vote.
This is setting a hearing on the proposed law.
Right.
That's what this,
Can we do to make it so that we, now to ban it for the public hearing now?
what could be done is amending the local law voted out of committee before a hearing is set on the floor of the legislature with an outright ban.
We can't do a ban right here, right now.
You could
we could,
recommend it, but don't have it before you. You really should have
Hold your hands.
what you're voting on before you. You could ask me to draw an amended local law, which I will do. And then, if you want to set a hearing, you still have to set a hearing on a local law, whether it's an outright ban or 21 and under.
Diversity first. Yeah, that's what I'd like to see happen.
Okay.
So my question is, how much of this, I agree it should be banned, but I don't want it to see a delay. We're gonna have to wait till the next meeting to look at the change and then set a public hearing.
My suggestion would be set both the public hearing on this law out of committee and then amend the local law before the hearing is voted at the full legislature, so it would be outright ban. And that way you have it on the full agenda for the following meeting.
Okay. yeah,
So
that-
what you have to understand is we're only the committee.
Right.
So before we move anything more forward, we have to approach the whole legislature. Legislative parties.
she already answered.
Okay.
So my understanding is if today we can amend to ban it.
Well, the local law should be in final. You
No, we
should
can
have it-
amend this thing.
My suggestion would be to vote this out of committee to set the hearing and have it on the agenda of the legislature. And then we will circulate an amendment to this local law with a prohibition. And then at the legislature meeting, you would simply amend this text with the other text before you set the public hearing. So that way it'll be in the packet for the meeting and people can comment on the resolution.
And then there's no delay.
So
And there's no delay.
So the amendment would happen at the,
Be amended at
at the
the
legislature,
floor
on the
of the
floor. Okay.
legislature,
Of the September meeting.
of the August meeting.
August.
the August meeting. The hearing would be in September.
There we
Thank you,
go.
thank you.
Yes.
Thank you.
Legislator Reed.
Sorry.
So in Article 1, the first sentence, it says, despite the legalization of the sale of kratom by the state legislature, can we, if they have already legalized the sale of it, can we overrule the state?
Well, that's something I would look at, because we didn't look at the outright prohibition, and I want to look at the regs. But I know that other counties have, not that it means that this legislature must follow other counties. We'll take a look at that and see if there's preemption in the field by the state to allow the sale versus the ability to prohibit this. Obviously, any local law can be subject to challenge. It's a question of whether it falls under our home rule authority or whether the state intends not to.
If we were to move this one as it is, Article 5, number 3, businesses within 500 feet of any school building, have you identified any of those? How many are there?
No, but we will.
No, that's the
It's
next.
defined as a building regularly used by a school district or other entity for instruction of pupils under the age of 18.
Yeah, we were gonna plug everything and map it out, pinpoint all the facilities
If it
that
were-
were within that distance.
Legislator Berger.
I just want to thank Vera and Rich for, pulling this together. It's really important to our community and, the safety of our children, our future, and our environments. Thank you.
Legislator Walker.
Thank you, sir. I also want to echo Legislator Bartlett's words, and I also want to give a big shout out to Legislator Bartlett for all her hard working, bringing this forward too. Thank you.
Anybody else?
Yeah, I am, in favor of banning it entirely, although my sister-in-law uses kratom for medicinal purposes and help her with a number of things in her person. And yet I think the crux of this for under 21 is to protect our children with anything that's available, whether you're 21 or 51 or you're 11, you're going to get it. I think banning the whole thing is the way to go. If it's available, they'll get it one way or another.
So you said she has to have it, but is it administered from a physician?
No. It's by her choice. However she acquires it.
Okay. Legislator Bartlett.
I was just going to go off that and say that, you will have people who kind of are all for it, but there's also the dangers behind it and, sometimes the safety of the population is so important.
Exactly.
I thank you for speaking.
Because it will.
Mr. Chairman, the other thing is the federal government is looking at scheduling synthetic kratom as a controlled substance. So depending on what the federal government does, and if they change that, there may be prohibitions that make this move. But at the present time, we'll proceed as outlined and get another provision to the committee by Friday.
So per recommendation, we will do this today.
Then we have a placeholder on the agenda, it's voted out of committee, and the process would be, we'll take a look at it and see what's possible and draw local law accordingly, then we would amend it on the floor of the legislature to substitute this text with the revised text.
That's what I get. Legislator Reed.
So, Rich, are you familiar with the rules that the state has created? Are we exceeding those? Are we charging more for fines? What's the penalties?
We looked at the public health law, 1399, MMM, there's also general business law, and developed a local law that would designate an enforcement officer for the purposes of kratom, being Board of Health or the Health Department, and a fine schedule for civil enforcement as sales under 21. If there's an outright prohibition, we will revisit that and see. But these fines are comport with the Health Department, only charged for similar violation.
Okay, thank you.
All in favor?
Aye.
Opposed? Motion carries.
So I just want to provide
Director's
a
report, I'm sorry. Director's report.
Right, okay.
Yep.
So
Sorry.
I'd like just to provide a few updates of activities going on across the health department. So EVA, the health department continues to move forward with the implementation of EVA, our enhanced virtual assistant. This is not new to the county system. EVA has already been successfully implemented and the Department of Social Services is now being expanded to the health department. We are participating and partnering with TIPCO, the Technology Innovation Partnership Cooperative, to implement the system in a phased approach. EVA consists of two components. EVA Phone is an AI assistant phone system that answers common questions, routes calls, and assists with appointments and scheduling using health department specific information. EVA Companion is a staff support tool that provides employees with real-time guidance and quick access to the department's information while assisting the public. Training is currently underway in our preventive services, children with special health care needs, health and families administration, and finance. The rollout for environmental health is expected to be implemented in mid-August. We're taking a deliberate approach with EVA. The system will not be available to the public until the staff are confident that it is providing the accurate, reliable, and consistent information. We expect EVA to improve customer service, reduce administrative workload, streamline appointment scheduling and call routing, and provide residents with more consistent and timely information. Health education and emergency preparedness. This Thursday, the health department is partnering with emergency management. We will be conducting a tabletop exercise that focuses on communicable disease, surveillance, and response. Several community partners will be participating, including New York State Department of Health, fire departments, EMS, our Oswego Health. And this will be providing an opportunity to strengthen the coordination and preparedness for future public health emergencies. I also wanted to provide a brief update on weathering the storm, the health impacts of severe weather. That's the health education mini grant that was approved. We continue to make great progress with this initiative. As part of the project, we trained 21 staff from OCO so they could educate clients on health impacts of severe weather and ways to stay safe. We also created and distributed 72 severe weather preparedness kits through congregate meal sites, SAFE, street outreach, and the options program. Rather than just simply handing out these supplies, these kits served as conversation starters. Staff discussed the health risks associated with severe weather, ways to reduce those risks, and how individuals can better prepare for emergencies. To evaluate the program's impact, recipients were asked to complete a post-engagement survey. The results were very encouraging. 85% reported drinking more water during hot weather events. 61 said they signed up for weather alerts. Excuse me. 41 made plans to check on family, friends, and neighbors during severe weather. Another 41% arranged for someone to check on them. 39% took steps to weatherize their home. And 27 spoke with their healthcare providers about how heat could affect the medications and medical conditions that they have. We're excited to build on this success and stay tuned for our winter weather updates as we start distributing those kits. These kits will include hats, gloves, scarves, hand and foot warmers, lip balm, emergency blankets, body wipes, and tickets. And we're hoping this helps the residents prepare for cold weather conditions. Overall, this grant has provided meaningful opportunity to combine education with practical resources, helping our residents become better prepared, more resilient during severe weather events. Our 2027 budget is in its final stages. We're currently working through just the final touches, and we anticipate that will be submitted in the next day or two. Healthy Families, we recently completed our annual Healthy Families New York State review. Preliminary feedback indicates that the program continues to perform at the highest level. No performance indicator or improvement plan was required during this visit. The reflection shows that the team is committed to providing a high quality of service and maintaining strong program standards. Our summer family event was very well attended. We had 13 families attend, and we are now planning for an August graduation. We've been running the program so long now that we are starting to have families that are graduating from this program. So that's a huge accomplishment. And we're also looking at other family events to hold this fall. Preventive services in our LICSA preventive continues to stay busy as immunization clinic demands increase ahead of the school year. Several off-site vaccination clinics are being held through all the county school districts. Communicable disease staff are seeing an increase in gastrointestinal illnesses, primarily the Campylobacter, Salmonella, and Giardia. At this time, we have not identified any of the Cyclospora. That's what you're seeing a lot in the news about. None in this area. Maternal child health currently has a census of 13 active cases. Children with special needs early intervention continues to experience steady referrals. We received 39 referrals in June and 20 plus in July, bringing this year to date a total of 206. We are also seeing an increase in families who speak only Spanish. That reinforces the need for language accessibility services, which we're doing very well with our language line, just so everybody knows. Child Find has received 86 referrals so far this year. Within our preschool program, we are seeing more families withdraw from summer special class in an integrated setting or SEAT services, allowing agencies to offer openings to children that are currently on a wait list. Summer evaluations are also trending slightly lower than previous years. Through our Children with Youth with Special Care Needs program, we're moving forward, finally, to purchase the accessible playground equipment for the Richland Town Park using the Community Accessibility and Inclusion Grant funds that we received. Caitlin, you want to give a quick update on your division?
Sure. Mosquitoes are a very busy program for us in the summer. Currently, no virus has been detected, which is very good. August is traditionally the month where we see that come out though, so we'll see what happens as the month goes along. Very dependent on weather, but our numbers have been a little low this year. But again, we'll see what August brings. Rabies is a big one this time of year. Our next rabies clinic is actually tomorrow in West Monroe, and we're looking to have very good numbers. As of 10 o'clock this morning, we had 206 appointments. Anytime we get to a 200 mark is usually a good number for us. So I'm curious to see what we'll have. We'll continue accepting appointments until tomorrow. So I'm very excited for that one. We have 7 positive animals so far this year. So I'm curious to see if our numbers are going to be a little higher than in years past. We're seeing them a lot in the same area, the Hannibal, Granby, City of Oswego, Town of Oswego area. But we did have 1 in Mexico and 2 in Constantia this year that were a little different than in years past when we map it out. So we'll see. We're going to continue to do a lot of education and press releases on that and really ensure that people are getting their animals vaccinated and have good bat information. We do have the bait drops going on from USDA. This week, I believe, they started on Friday. I'm not sure entirely when Oswego County is going to be done. We're supposed to be getting notified when those are complete. It's mostly in the northern area. Only a little bit of our county is affected this year. Jefferson seems to be where the main problem is. So unfortunately, we're getting a little less, but anything is better than nothing because it definitely seems to be working in that northern area. And the only other things I was gonna touch on, just the two big festivals that happened in July in Oswego County. We had the Oswego County Fair, the 1st through the 5th. We did a lot of inspections. There's a lot that goes into the Oswego County Fair. So we did 19 food service inspections, which produced 3 critical and 1 non-critical violation. The remaining operations, the fairgrounds, the temporary residence, and the campground produced 5 non-critical violations. There will be a training conducted with the fair later this month. That's something our staff does every year, and they do a lot of prep work before the fair as well. A lot of training, a lot of certifications with the staff that run the fair. Harbor Fest ran the 22nd through the 26th. We had 47 inspections done for food service there, including 4 re-inspections, and then there were 8 additional field visits that were conducted for 43 vendors total. We had 11 critical and 10 non-critical violations documented. 1 non-critical was also a smoking violation though, that falls heavily under the Clean Indoor Air Act. So even though it's a non-critical violation for food, it's a major violation under the Clean Indoor Air Act, so there will be something coming for that. And then the violation numbers don't seem terrible when you think of 47 inspections. There were a lot of violations though that were written that included multiple food items out of temperature and things like that. One also included a vendor not having potable water at their unit. So some of them were pretty big issues that we had to work through. One of my staff members had a meeting with Harbor Fest Committee yesterday with the new director, and already has some plans moving forward for next year to kind of work out some of the kinks that we had, some paperwork issues, and we're gonna start moving forward with that now, so we're prepared for next year when the applications start coming in.
Thank you. Mr. Wolf.
Yes, so you had 47 inspections for Harbor Fest
Correct.
and 11 critical.
11 critical, yep, and non-critical
And what
violations.
was the major one that
So most of the critical violations were all foods out of temperature, whether it was hot food, cold food. Some were just not being stored under refrigeration or hot holding at all. One of the criticals was the non-potable water. They didn't have any potable water at their facility.
and what did you do to them?
So they had to be shut down until they could get potable water. And it was about, I think 2 or 3 hours later, they contacted the inspector and said they had potable water. She went, confirmed, and then they were allowed to reopen.
Okay. In the city of Oswego, do you have stats and figures on how many inspections you did in the city of Oswego and criticals with you today or no?
Not with me today, but I could. I could get you the year's worth last year, whatever.
Yeah, no problem. And the person that smoked, what did you do to them? They just, you tell them they can't smoke?
Yeah, they had to put it out, go wash their hands, not continue to serve the food until they got their hands washed. But they will be getting a fine under the Clean Indoor Air Act for smoking while they were cooking food.
The new director for Harbor Fest is gonna do a good job. I'm also on
Yeah.
that committee. So
I'm very excited. She seems very enthusiastic and wants to make things even better. So
I'll be talking to her about the health department and the good things you guys do. And thank you for going there.
thank you.
Appreciate it.
Mr. Klein.
AI or EVA. Okay, you've got to answer phones and rerouting the calls where they belong and all that stuff. So they're saving a lot of time out there, or will.
Well, yes,
Okay.
right now it's a lot.
What do we have for those people to do? Are we laying people off or we're filling, what are we doing?
Nothing. We are waiting, we're collecting data.
Okay, so you're looking at that.
Mhm.
All right, now, you mentioned severe weather events and your work on that. EMS does that too, right?
I think everybody's, yes, emergency management.
Yeah.
Yes, absolutely. They do, yes.
Are we doing the same thing in both departments? Because I mean,
No, I think we do it at different levels. We complement here. We work very well together. We complement each other.
well, I know, but I just don't want to see.
We try not to be silos. We try, know what each other are doing, so we don't overlap services.
Yeah, I don't want to be paying people twice to do the same thing.
No.
Okay, and last but not least, but wasn't brought up, mosquitoes. Where do we stand on them?
Mosquito numbers are down this year. We haven't had any disease carrying. Well, actually Flanders, I think we had a positive.
Yeah.
Flanders that we get information on, but it's not, a public health.
No Triple E or West Nile at this point.
No Triple E West, that's how I should have said it. No Triple E or West Nile at this point. Identified in our mosquito traps. We collect from 50 different sites. 11 sites, 50 pools we've been sending in. Yep.
But it's also accident to help us that we have very dry weather for the last 6-8 weeks.
Yeah.
I've even noticed down taking that much, not complaining.
Not complaining. So we are doing surveillance, we are moving forward. Soon as, if anything's identified, we'll be doing aerial spraying.
Okay.
Anything that's, public health risk.
So you mentioned that there were 86 referrals for child find.
Yes.
Is there a wait list? Are those children getting services right away?
Child Find is the part of the early intervention program that's responsible. We just track children through birth through 3. And we look at risk for developmental delay. The focus really is to make sure that the child has primary care. So there's really not a wait. We receive referrals for these children all the time. We want to make sure they have a primary care provider that can complete the developmental screenings annually or whenever it's needed, whenever the milestone comes up. That's what that program is. It's just a very small piece of our bigger program.
Okay, but so it's maybe not perfect. But if a child is identified through child find,
Yes.
how are those services paid?
Then we will go into our children with special needs program and they will be set up through the school district is the 3 to 5 program.
So that's basically.
That's the big
Oh,
program that we're,
to
the
provide
fall,
that.
yeah, we're the pass through
Okay.
to make sure they get transportation so they get the services they need, the therapy services.
Okay.
I
And
can actually give you a program overview of
that'd be
each
great.
one.
That'd be
Okay,
great.
because these programs, it's very confusing. It is because they all kind of mesh together because they refer off each other. Early intervention is our program we provide and make sure and set up for therapy services through that program. Where the preschool program that is the one that goes through the school, but we are pass through for the funding.
Okay. And of the 206 referrals, does that include the 86 or is that just separate numbers?
Oh, that's a separate number.
Separate numbers?
It's 4 different programs within one division.
Thank you.
You're welcome. I'll give you that, and it does a nice breakdown. So in closing, overall, the department remains very busy across all the divisions. I appreciate the continued dedication of our staff. We remain balanced in our daily operations. We're implementing new technologies, preparing for upcoming budget year, and they continue to provide a high-quality public health service to the residents of Oswego County. So thank you, and I'm welcome. Any questions?
Any other questions?
Motion to adjourn.
Looking at the appropriate.
I'll second comment before we adjourn.
Go ahead.
Thank you. A couple of months ago, I'm glad the chairman's here. I have a question. A couple of months ago, I talked with Chairman Weatherup and having the health committee and social services combined together. And if we didn't have this resolution on it today, we could have possibly had 2 months without a meeting here. And I know social services is with human services and human services, social services. I think it'd be a nice fit if social services and social services and the health committee could be combined. And I did ask the chairman a while ago. And I'd just like to put it on the record that I'd like to see that happen if the chairman decides to do that. But like, again, we wouldn't have had a committee meeting today if we didn't have a resolution. It would be 2 months without a committee. So I think it would take the burden away from human services if we combine the two. Thank you.
Let's say your point.
Yeah, I want to point out to you, Lee, because I'm on both committees, yesterday's meeting was 2 hours and 45 minutes long. So now you add another hour and a half, you're talking over a 4-hour meeting. And we have her, and then go to our director of human services. They have other responsibilities. They can't be tied up that long. So, years ago, it was together,
Right.
and it was a demonstrative problem.
Yes, I would all re-comment on that. This is the longest meeting we've had since I've been here in January. Most of our meetings have been pretty short. So, today is a long one, but most of our meetings have been, half an hour. Thank you.
Yeah, I'm not gonna comment on the merits of the idea, but just procedurally, the committees are delineated within the rules of the legislature as to which departments report to which committees and which committees there are. Those can elections, it's not just something the chairman can do on his own. That's a rules change that happens every off years.
Okay, thank you.
Any other questions? Now the appropriate motion.
Motion adjourned.
Second.
Favor?
Aye.
Phil?
Thank you, Laura.
Sure.
Thank you.
You want,
Yeah.
Small homework.
Caitlin, great job.
Yes.
Eric, can I see you from?
Absolutely.